Good day, everyone, and welcome to Cochrane Canada Live, the research webinar series brought to you by the Canadian Cochrane Centre. My name is Adrienne Stevens, and thank you for joining us for to webinar 3 of 4. And so today's webinar and then the webinar next week, we're going to look at that sort of snapshot view, the steps of conducting a Cochrane review. And as always, I'd like to thank the funders of Cochrane Canada, those being the CIHR, Knowledge Synthesis and Exchange branch, and a number of their entities. And I also want to acknowledge PAHO, that's the regional office of the WHO for the Americas, for providing Illuminate Live to us to conduct these webinars. And as most of you know, and just in case some of you have only joined for one session, or maybe this is your first session of the series, if you want to ask a question during today's session and you've joined with the microphone, just simply click on that button. That would appear currently under your participant view where you see your name and the name of the other participants. Feel free to send through emoticons during the session. We're going to do some polling again during today's session. And if you aren't joining with a microphone or wish not to use it, feel free to send your questions or comments to the chat room, and we're also going to have some brainstorming discussions as well. So feel free to use the chat room. Again, the format of our webinar is one audio activated at a time. So yes, if you're joining with a microphone and you wish to use it, then raise your hand and I'll prompt you to go ahead and ask your question. So you just simply click on this button, and again, once you're finished, click it again. That releases the audio back to me. And during this session, if you happen to notice a bit of an audio delay that doesn't improve within a reasonable amount of time, feel free to log out and log back in again. The system will allow you to do that, and it should rectify that for you. If you notice a brief interruption in the audio stream, and it might be just a little blip for a second, not to worry, you haven't lost any audio as Illuminate continues to stream that to you and keeps backup recordings throughout the session. And again, just feel free to send your questions into the chat room and I'll answer them at the time points that I've sort of put aside for questions. So a quick look at our agenda. I'm just going to show you a quick list of the steps of conducting a Cochrane review and talk to you a little bit about the process. Then we'll talk about sort of who's involved in this, what do I need. We'll have a bit of a discussion about protocols, and then we'll look at those steps. So we'll look at starting from the question all the way through study selection. So I put together a quick sort of list of the steps of, sort of what it is to conduct a Cochrane review. And so just starting at the top, so the first thing you need to do is define your research question. And once you sort of have a question in mind, it's at that point that you contact a Cochrane review group. You can go to cochrane.org. They have a list of the number of review groups there. And if it's something that's difficult to find or you're not sure you have the right information, please feel free to contact any of the Cochrane Centre. So if you're here in Canada, you can contact us here at the Canadian Cochrane Centre, and other countries have other reference centres that they can contact. And it's that point that you would register your title. And so there's a title registration form that you fill out. You need to have at least 2 people who are willing to conduct the review, and you sort of give your sense of your expertise. You declare your conflicts of interest. You have a sense up front of the roles and responsibilities of the authors, and then you lay out your review question, and we'll look at the parameters of that in a minute. You can estimate the time frame. And sort of your commitment to update the review and to publish it on the Cochrane Library, etc. So that gives you a sense of the title registration process, and that's something that you can obtain from your review group. And then sort of tied with your research question is you need to define your eligibility for including studies. And you also determine your methods for conducting the review, and all of this is included in a protocol, and which also goes through editorial and peer review. And so peer reviewers, the external peer reviewers, could be a consumer, could be someone who would be an end user of this. So if it's a clinical topic, they would sort of choose an appropriate clinician who has expertise in that area. It could also be a statistical person or a methodological person, sorry. So I've done one for for the Cochrane EPOC Review Group, for example. So there are a number of people who can be involved in this process. Once you have all of that outlined, then you go through the process of actually conducting the review. So you execute your search for studies, you apply your eligibility criteria, you collect your data from the studies that you've decided meet your eligibility criteria. Then you do a critical appraisal of your studies. You analyze and present the results of the data that you've sort of extracted from those studies. You go through a process where you interpret your results, form conclusions. Then you complete your structured report. And it's at that stage that, again, your draft review goes through editorial and peer review, and then it's published on the Cochrane Library. And then thereafter you update it. And that as well may or may not go through editorial peer review depending on how much information you have, whether conclusions have changed, etc. And I suspect that different review groups have different policies for that, so certainly your review group would let you know. And then it's published as well. The update is on the Cochrane Library. So that gives you sort of your snapshot view of the steps. And to get a sense of time frame, so the point at which you register your title, it's expected that within 6 months you would have your draft protocol ready for peer review and editorial review. Once you have your protocol published, you can expect about 1.5 years. It does take time depending on how much information you have to synthesize and the time you have available to actually devote to writing the review and doing the work of the review. So that's 1.5 years before you submit your draft. Once your review is published, it's about 2 years. That was a question I believe posed in the first webinar, was sort of what's the time frame to update. The rule of thumb is about 2 years, but again it might depend on your content area. If there's been a lot of publishing, for example, you may have to do it sooner. So that gives you a sense of the steps, the process, and then what I did is I wanted to create a schematic that we could sort of walk through all of the steps and you sort of had a reference point. And it's a shame that the image that I created isn't turning out exactly as on my slide, so a little bit of a conversion sort of issue uploading it to Illuminate, but it'll look much cleaner on your copy that I sent to you at the end of the session. So this is the wheel that I'm going to use, and it sort of goes through all the steps and then sort of what the update process is. So I'm just going to pause for questions. Do you have any questions at this stage in particular with the process? And I'm going to go through in more detail each of the steps. Are there any questions as of right now? Okay. Well, let's carry on. Again, feel free to send them in the chat room if you think of any. So next, who are the players? What else do I need? So as I mentioned, you need to have at least 2 people, but certainly more is encouraged. So if you were to just have 2, the minimum would be someone with content expertise in the area that you're planning to do the review on, and someone with systematic review experience as well, so that partnered together you can sort of work through your review. Certainly you should be considering additional ranges of expertise. So, you know, someone who has statistical expertise could become a co-author. Doesn't necessarily have to. Certainly a lot of groups have statistical editors as part of their team, but you're also encouraged to seek out sort of any local statistical support that you could have. Most groups have a trial search coordinator, so that's essentially someone who goes and does the search process with you. And sort of handles studies that are related to a given sort of review group. But again, you could just be using the expertise of the trial search coordinator, and they may or may not be a co-author. Certainly, you know, if you have folks who are, you know, readily available for translation, they could be a part of your team. Certainly, international participation on the review team is encouraged. So, you know, do give some thought to that, and definitely, you know, having consumers on your sort of co-authorship team, you know, colleagues or relevant stakeholders from various regions and settings are certainly encouraged. So it gives you a sense of sort of the breadth that you need to take to make sure that, you know, you're creating something that's robust, that's, you know, of interest and relevance to the end user. Because at the end of the day, when you're putting all this effort into creating your review, you want it to be used. And certainly the idea is you don't just create the review once and then that's it, that you're also committed to updating the review. And certainly if a review becomes out of date, it could possibly be withdrawn from the Cochrane Library because it doesn't represent the most up-to-date relevant evidence. And so committing yourself to updating the review and keeping it relevant is certainly important to this process. So if we were to take a look at sort of who the editorial team is made up of, your main sort of point of contact will likely be the managing editor, and so that person coordinates all of the work that is done within the portfolio of the team, and they're quite well versed systematic review methodology. You can ask a lot of questions to them and bounce off a lot of things to them. The trial search coordinator, as I mentioned, they're involved with executing the search, helping you out with search strategies, etc. And they also, for most, maintain their own registered studies, so studies that are relevant to their review group. The editorial team is led by a coordinating editor, and there are also other editors on the team. So when you're doing a review, you may not necessarily get the coordinating editor as providing feedback on your review, but one of the other editors on the team will do that, and they can meet. I know some of the groups, the editorial board meets at least once a year or whatever is relevant to discuss policy and methodology and how to update all of that information and make sure that, yes, you are using the most robust methods to be conducting your review, and for them making it relevant to whatever the clinical area is. As well, other contributors include the peer reviewers. So I've sort of discussed them already, but external peer reviewing is an opportunity for someone with expertise in an area that, if they wish to be involved with Cochrane, can provide feedback on protocols, can provide feedback on reviews. So if you're not currently formally connected with Cochrane and you're sort of processing a way to get involved, that's a great way to get involved, along with actually authoring a review. And so if we were to look at server and software, so just as a quick sort of for your information, there's a standard software that everyone uses to create Cochrane reviews. It's called Review Manager. So as I've listed here, it's what you use to write and edit your reviews. And it's freely available software, and you can download it on your machine. And so what your computer does is, via the internet, connects with Archie, and that's a server that's used for storing drafts and published versions of your review. And from Archie, everything is published to the Cochrane Library. And so if you're a review author and you're not sure whether you have your Archie account, connect with your managing editor, and they'll be able to provide that to you. Another software is called GradePro, and that's relatively new. It's been out for a couple of years now, and that's what's used to produce the summary findings tables. We'll take a look at what a summary findings table is next week, but the idea is it's the process by which, and in behind it is the grade assessment that you use to determine the quality of your evidence. And so Gradebook can be used on Windows-based. There aren't similar applications for Macintosh or other, but within RevMan, there is an option that you can create your table right within RevMan. So they have thought about all of those items, but with RevMan itself, they have versions for Macintosh, for example. Okay, so are there any questions about the items that I just covered, about sort of people being involved, thinking about your review team, what you need to actually conduct your review? Okay, so I'll move on. So let's take a quick look at protocols. So I just want to have a bit of a brainstorm session here, so feel free to enter sort of your thoughts in the chat room. But if you were to think about, what objective would a protocol serve, how much time should be spent on drafting it, and who should be involved in this process? So I'll just give you a minute to think about this. And feel free to enter items into the chat room. And I know there's a couple of logins here where you have a room of people and maybe you're just discussing things right now. So I'll allow you a minute to give some thought to that. Again, you can just enter things into the chat room, enter your ideas. Okay. Okay, so why don't I just carry on? Then the idea with the protocol, it's your framework for conducting the review. And with systematic reviews, you know, at the point that you're going to look at doing a systematic review, there are already trials or studies published in the area, and you probably have some sense of what's been done, the data, etc. So they are retrospective in nature, and so the idea with the protocol is it is a safeguard to trying to minimize bias. Before you actually look at all the data of all the studies that are available out there, you want to have a framework so that you are led by what you think is important and not what the studies say or the data that are available. And so, you know, as a result of that, much time and thought needs to be put into it so that you are thinking through all the possibilities and having a sense of what it is you're wanting to synthesize at the end of the day. Not everything has to be set in stone, in that sometimes changes are needed if there's an important change in your content area, maybe regarding outcomes. Certainly if the methodology has advanced since you've published your protocol, then there are some things that can be changed. They need to be justified and documented in your review, and really they should be kept to a minimum. So it should be, you know, it should be strongly justified why you are making a change. And I think transparency and clarity are fundamental throughout the process, throughout all of the steps. So you really do need to plan, you know, or explicitly outline what it is you're going to do through the process. And to give you a sense of what's included in the Cochrane protocol, so as my first point shows that there is a standard format for all of the protocols. So once you've taken a look at one protocol and you want to look at multiple ones, then it is easy to find the information that you want to look at, they're wanting to find. So, a standard protocol would have a title, would have the review authors, who the contact person is for the review. It should have quite a detailed background, so it gives you rationale for, you know, why it is you're looking at it, maybe information about the condition of interest, information about the interventions that you're looking at, so it should be quite detailed. It outlines the objectives, and that's more or less your research question, your eligibility or your selection criteria. It does define every sort of database or other source that you're planning to look at in terms of search methods, and should have a sample search strategy as part of it. How you plan to collect your data, your process, what you're prospectively thinking about in terms of your analysis, and it has also your declarations of interest. So any conflicts of interest need to be outlined. So are there any questions about protocols? Again, they're published on the Cochrane Library. One nice thing about the Cochrane process is that you're not just conducting your review and then having a group of people look at it at the end. You have sort of your editorial and your peer review input along the way, so you can have a confidence that what you're producing is robust, and you have that support during the process. Okay, if there's no questions, then I'll move on. So let's look at the steps of conducting a review, and the first step is setting your research question. There's two things that you need to do when you're developing your question. First, obviously, you need to identify what type of question you're asking. And so, this slide and the next just sort of outlines, that there are different types of questions out there, whether you're looking at benefits and harms of a treatment in animal models, maybe it's that in humans, looking at the service delivery configuration, looking at quality improvement, looking at diagnostic test accuracy, looking at coding for hospital discharge, something more qualitative maybe, looking at the experiences of patients, looking at prevalence or sort of gene association studies, and of course there are a lot of other questions. And so there are lots of different questions out there, but Cochrane's focus is on questions relating to an intervention, so that could be a treatment, prevention, rehabilitation, for example, so anything at which you're intervening, and then questions related to diagnostic test accuracy. So the next thing, so we talked about we need to have a question, so we need to have some sort of framework, and so PICO's been around for a long time, and that's what the collaboration endorses and uses to be able to frame your questions. So you're looking at your population, you're looking at your intervention, your comparison, and your outcomes. And so if we think back to last week's session when I did a quick search on the Cochrane Library and I was looking for exercise for type 2 diabetes, that fills in the P and the I of the PICO. So that gives you some sort of framework for when you're searching. But certainly for your review, you need to have all of those items outlined. When you're developing your question, you'll need to give consideration as to how broad or narrow your question is. And so this would involve discussion with your review, with the whatever review group you're interested in doing it with when you're at the sort of title registration stage. And there are issues related to broad and narrow questions. And for reference, you can look at the handbook. They've outlined them here, but due to my time, I don't have much time to look at that here. So if I was to sort of throw up an example, and I just want to just acknowledge that Wiley Blackwell, provided sort of these as courtesy to me to be able to add into the webinar. So if I was to look at a question, this is from a review that's been published on the Cochrane Library, and so they've outlined that their objective was to examine the effectiveness of spinal manipulative therapy on pain, functional status, and recovery at short, intermediate, and long-term follow-up measurements as compared to control treatments, and they've given a few examples for adults with chronic low back pain. And so if we were to identify the PICO of this, then we could see that here's your P, so it's adults with chronic low back pain. That's the population that we're looking at. Your I, your intervention, is spinal manipulative therapy. Your comparison, so they've indicated their control treatments and they've provided some examples here. You may not get this level of detail with all of the reviews that you come across. Some objectives are quite brief, some are longer, but this is certainly a nice example that's taken that time to really be explicit at the objective stage. And this is the outcome. So they're interested in pain, functional status, and recovery at certain defined time points. So that gives you a sense of PICO, and so the objectives part of review of our protocol outlines your PICO in brief. So let's take a look at the eligibility part, because that's tied quite closely to your question. And so what this is it's your PICO, but it's really quite detailed, and you're also specifying what study designs you're interested in looking at. And so from this, out of this, set your inclusion and exclusion criteria, which is important and needed to help you define the search, so you know what it is you're looking for. It search to get you thinking about the analysis. So I sort of have an understanding of what my intervention, what comparisons are, what my outcomes, what am I expecting down the road, what do I need to outline in advance. So it gets you thinking about the analysis, and then we'll minimize bias at the selection stage. So you define in advance what it is you're interested in, which safeguards against looking at all of the available papers or trials or studies, and making your decision from there. So we don't want to do that. We want to have it all defined in advance. So let's take a look at the population part. So if sort of I said, it needs to be detailed, well, what is it that we need to include? And so you need to define what your disease or condition is, and you need to think about other related factors. So if you're talking about duration, so if you're talking about acute versus chronic, for example, if you're talking about severity, location, so location sort of on the body may be a consideration. Maybe other factors that you need to consider, like age. The setting, so some may just be looking at outpatient or hospitalized patients, for example. Thinking about who should be making the diagnosis is important. And maybe there are types of people that need to be excluded, so they react to the intervention differently. And so, it may be important that they would actually shouldn't be combined in with those that you're actually interested in evaluating, but should be considered separately. So I just put an example from a review that looked at interventions for preventing hamstring injuries. And I just thought I'd put a few examples and just talk about sort of why I chose it, and sort of point out what it was that I liked about it. So, they're very explicit about the fact that, they're looking at physically active people who are at risk of incurring hamstring injuries. And, what a hamstring injury is, should be defined. And some authors may make this definition in the background section of the review, for example. and not necessarily outline it here, and that's what was done in this particular review, for example. They've indicated that they're interested in people who are at the adolescent stage, and they provided what they're going to use as a definition for that. That they're also interested in adults. They've addressed that they'll include them sort of irrespective if they've had a history of hamstring injury or not, but they've thought about that and they've made it explicit. They've indicated that they, what they were going to exclude trials for, and then they made it explicit sort of, that they were not going to look at children below the age of 10 years. So I thought it was good, they provided definitions, thought about, possible variations within the patient population, and then explicitly stated exclusions. Taking a look at the intervention comparison. So again, you have to define your intervention, and then surrounding that, you think about, are you looking at sort of single or combination interventions, and especially for drugs or other therapies, looking at route of administration, preparation, dose, how frequently the intervention's given, for how long the intervention's given. What about co-interventions? So thinking through other things that might might be encountered in studies. How are you going to handle them? So that's the intervention. And then as well for the comparison, how are you defining your comparison or control group? Is it an active one, like a different drug or a different kind of therapy, or is it inactive, something like providing no treatment or providing a placebo? So these items you need to outline. And just to provide an example, so this is from a review look at antioxidant supplements for preventing GI cancers. And so here they specified their supplements and indicated at any dose, duration, route of administration. So they thought all that through, indicated what their control was, so it was placebo or no intervention. And they specified the possible intervention arms. So they considered what possibilities might exist and how they would deal with them. So their comparisons and their analysis should then follow accordingly to that. They addressed co-interventions. So if something was going to be given, how they were going to handle that. And if there were also trials that had subgroups where patients with GI cancer could be extracted separately, then they would look at including that. So they've thought through quite a few things when they've outlined their intervention. The next item of the PICO is outcomes. And so for this, you need to determine all of the important outcomes for decision making. So, it doesn't matter what you think has been reported on in the literature. You don't want to be led by the data and publications, but you want to be led by what really matters. And so, outlining all of the important ones I think is an important thing to really be aware of. You need to determine what your primary and secondary outcomes, and therefore your analysis will fall from that accordingly. With your primary ones, you need to have at least one positive and one negative outcome, and the idea is that primary would meet 3 or less. You should be considering adverse effects, and you can give thought to whether you wish to look at economic data. And so as a result of all this, yes, you shouldn't be including trivial or meaningless outcomes, but ones that make sense to the audiences that you're writing this for. And that includes consumers, and includes whoever it's directed to, so whether it's a policymaker, whether it's a healthcare professional, for example. So considering all that's important, and I think that underscores why it's important to have breadth of players involved on your review team, why it's important to have the editorial and peer review processes to make sure that all of this has been considered. And as well, you need to think about sort of the type of outcomes that you're looking at and the timing of the measurements. So whether it's something like short and medium long term, as is in the example that I gave. And so to give an example, I pulled one from a review that's, or it's a protocol actually, it's still the protocol stage. Looking at interventions for increasing fruit and vegetable consumption in preschool-age children. I like that they were explicit in what their primary, what their secondary outcomes were. It wasn't just that they looked at, did they increase consumption, but they define exactly what they're looking for. So number of portions or servings, grams of daily food and vegetable intakes, biomedical markers, for example. How the information would have been collected. So for here's diet recalls, food diaries, questionnaires. They've already considered long versus short term, and they've defined it. So this is what short term means, 3 to less than 12 months. Long term means 12 months or more. They consider adverse events as well as economic data. And finally, study design. So as you had seen when I looked at the objectives part, you don't talk about study designs when you're setting your PICO, but it's certainly outlined in your eligibility criteria. And was sort of brought up earlier, in webinar 1, was a discussion of, does Cochrane just use RCTs? Most will, because that is the most robust study design for a lot of the interventions, but there are groups who have to expand to other study designs. Again, it needs to be justified why you would be doing that, because you shouldn't be considering less rigorous designs based on whether you think no RCTs have been done. If you've identified a research gap, then that is important in and of itself. And the Cochrane EPOC group is an example of a group that needs to look at designs that are not just RCTs, but non-randomized designs based on the type of interventions that they look at. So I thought I'd also note that if you're interested in more of this discussion about including non-randomized studies in Cochrane reviews, check out Chapter 13. That's available in the Cochrane Handbook, which is freely available and browsable online. Chapter 14 has a discussion about adverse effects, and Chapter 15 is about economic data. So to take a look at an example of study design, so this is from a review that looked at combined chiropractic interventions for low back pain. And so here they've outlined that they're only looking at RCTs and that non-randomized studies, observation, etc. were excluded. They did indicate that trials in any language were considered, as well as published and unpublished studies. And that's part of the Cochrane methodology, is to do that, is to not just look at published studies and not just to focus on one particular language. Okay, so I'm at the question time, and so I know there have been a few that have been added into the chat room, so I'll take a look at those. How important is taken into consideration from a consumer reviewer? And so certainly important, and I guess it was the first webinar maybe I mentioned about the Cochrane Consumer Network, and the collaboration has also hired a consumer coordinator. So the consumer voice into protocols and reviews is really important to the collaboration, and as such they've created vehicles and avenues for consumers to be involved. I think different review groups have different levels of engagement of consumers. I know I can't speak for all. I know that the Cochrane Musculoskeletal group uses consumers quite a bit, has consumers quite a bit involved in what they do, certainly. At the Canadian Cochrane Centre, we generally try to, with our annual symposium, have something available for consumers. We also offer stipends for people who are wishing to attend the symposium as well. So if that's something, if you're from Canada and that's something you're interested in, please feel free to drop us a line or check our website, which is cc.cochrane.org, and when we have our symposium information available, then we will put that up online. Who decides which is an important outcome? So when you're thinking about outcomes and back at that stage, so that would be a discussion among the reviewer team. For a lot of the review groups, they would probably have policies around that. So I know the Cochrane Musculoskeletal group does. So they've outlined outcomes that are really important to look at in all of their reviews. But certainly if you have any questions about, is this important enough to be primary or secondary, then those are conversations that you can have with the editorial team, you can have with the managing editor, etc. And through that process, come up with what you think is important. And how to dichotomize it, whether it's primary or secondary. Who decides what's a trivial outcome? Give an example. You know what? I can't give an example offhand. That's something I'd have to look up to get a really good, robust example. I can certainly ask around if you're interested in that, something that maybe someone's experienced. But it would be certainly something, at least from a conceptual viewpoint, something that doesn't make sense for practice. Maybe it's, and I'm just throwing an example, maybe it's a laboratory test that really, at the end of the day doesn't really impact practice all that much, for example. So I'm just sort of thinking on the spot, but I can certainly ask around for an example and send one to the group if you wish for one. Great questions, thank you. Okay. So let's look at the search for studies. Okay, so to look at why systematic searching is important, so just to sort of take a step back and think about the importance of this. So you want to be able to find as many relevant studies as possible, because you want to obtain the most comprehensive data set as possible, which impacts your estimate of effect. So if you don't have a comprehensive set, if you have a subset of everything that's out there, then you may not have all the information that you need. And so as a result, your estimate based on the smaller group of information may be different than if you had included all of the information. And that's certainly the case with something like publication bias, where the tendency is to have more statistically significant results being published as opposed to studies or trials that don't have statistically significant results. And so as a result, if you're only looking at ones that are published, then your estimate may be quite different than if you looked at the full volume of information. Because at the end of the day, we want to make sure that what we have is robust, that it's truly reflective of what is occurring, because it does influence practice, policy, and healthcare decisions. So I hope that helps to underscore the importance of having a systematic search. And so we want to be able to minimize bias, and publication bias is just one example of a number of other biases that could be taking place. So you need to have a thorough search. It needs to be, as I mentioned earlier, explicitly outlined, such that if someone reproduced what you did, they should come up with more or less the same results. And so it is more than just searching Medline. And yet, no one can come up with the perfect search strategy. So at the end of the day, you need to have something that's comprehensive and yet feasible. So you decide in that process when you're talking with the trial search coordinator, when you're speaking with other people in your review team, finding that line of, yes, we feel like we've been able to comprehensively pull the information together that we think to the best of our ability when you're pulling together your search. So absolutely, your first step is to talk to your trial search coordinator. And so when you're doing that, different review groups offer different levels of assistance. So you may have a trial search coordinator who can design your search strategies, run them, send you searches, help you with sort of review management software. And you may have other trial search coordinators, depending on if they're full-time or part-time. They may not be able to provide, that sort of same level of support. So you work that out, and in cases where you don't have the availability of a trial search coordinator, then you can certainly seek out a local medical librarian to be able to help you out in this process. But you do need to talk to your trial search coordinator first before you do any searching. And so if I was to ask you, what sources would you search to locate studies, what would you say? Do you have any examples out there of places that you would search? Okay, so someone said PubMed, absolutely. Medline, Central, Embase. So those are electronic databases. Clinicaltrials.org, excellent. So with the idea that you can look for ongoing studies and see if those ongoing or maybe even closed studies are available out there. Hand searching. Hand searching is certainly something that the collaboration does. And that's basically you access a journal, whether it's a paper copy, an electronic copy, and you go through page by page and try to find if there are trials that would be relevant to your area. Hand searching is certainly something you need to talk about with your review group because quite a few of them do hand searching on their own, and so may already have within their own specialized register of studies, ones that are relevant to their review group. Trial, they've already hand searched the journals that would be relevant, but it's certainly worth a question to the review group. Conference proceedings, absolutely, because not all data are necessarily published. So conference proceedings can provide you with data that may or may not be available in another way. That's great. Okay, so a lot of people indicated, yeah, a lot of those electronic bibliotic databases would be a source that they would search. Certainly Central, Medline, and Aimbase are sort of the primary ones a lot of people would search. And you can talk to your trial search coordinator about other databases that may be a relevance to your area, and that's worth searching. Gray literature is certainly important, and so in essence that's information not formally published in books and journals, and is important, especially for what I mentioned previously about publication bias, to try to find relevant studies that are not published in journals. Hand searching was brought up. Reference lists are another item. So you go through a review or the studies that you've included, and you actually go through the reference list to see if you can find other relevant studies. There's also the option to contact pharmaceutical companies, especially for data that may not be yet published. You could do internet searches, although there's little empirical evidence to suggest to sort of understand the value of general internet searches, but it certainly is an option. And as well, you can do personal communication to experts in the field, maybe contact people for studies or trials that you've included already in your review to see if there's other information out there. And just for reference, about 10% of studies in Cochrane systematic reviews are gray literature, which is, I think, an important thing to think about that underscores the importance of seeking it out. So if I was to ask you, was searching more extensive than you originally thought? Let me know. For some of you who are a little bit more versed in systematic review methods, maybe I'll just ask you to decline from answering this. I'm more interested in people who don't have a sense of the process already, maybe just to find out, whether or not this was helpful and sort of, broaden their scope of understanding. Okay, so just allow you another minute to cast your vote. Okay, so we've had a few people vote, and so some of you, yes, are pretty familiar with sort of comprehensive systematic searching for looking for studies and trials, but some of you weren't, so that's great. I'm glad that this session has been informative. So if I was to take a look at some examples, so this is one that I pulled from a review that's the interventions for preventing hamstring injuries. So they indicated where they were searching, so the different databases. They provided the time, sort of the timeline, so the date up until which that they searched. So you have a sense, you have a timestamp on the data that's included in the review. That they also searched for ongoing trials and recently completed. No language restrictions were applied, and they actually explicitly provided the search strategy for the electronic databases. And as well, they looked for theses and unpublished studies by contacting experts. They did reference list checks, and they also did hand searching as well for this particular example. So you can see that they've quite explicitly looked in various places for information that was relevant. And this gives you a sense of the search strategy. So if you're more interested in information about how you put together a search strategy, this is something that would be more explicitly outlined in what we do in Canada is a 2-day workshop, author training. So it takes all of the steps and goes in more detail. So this would give you a sense, but just like last week when we looked at Boolean searching, it applies the same principles to be able to combine different terms for your intervention, for your condition, and then adds a study search filter in most cases to do that. But that gives you a sense of what a search strategy looks like. So I had a couple of questions come through. Sorry, just allow me a minute to read these. Any WHO search in their trials registry can be done, not just clinicaltrials.gov. I think that's what was mentioned here. And so yes, certainly there's more than just clinicaltrials.gov, but the WHO has a register as well that you can search. With regard to pharma companies, do they not only publish the best results? How do you find out about the ones that have negative results? So all you can do is really contact them and find out, you know, is there other trials that they've done, and you may know of some as well that they have done, but not necessarily seen the results. So it's good to follow up with them and find out if they've published and where, and if they haven't, if they can provide the results. Yes, okay, so yes, they were, yes, thank you for the suggestion about looking at the WHO search portal to access ongoing completed trials. Great, thank you for that, that's excellent. Okay. So moving along, we're looking at study selection, and this is the last item that we're going to look at today. And so the other steps, starting at collecting data and appraising through to updating, we will take a look at next week. So for this, you want to make decisions about which studies you want to include, not based on the results. And I think, you know, we sort of already addressed that leading up to this point, underscoring the importance of why it is you need to outline all of this in advance. So yes, you need explicit criteria, but you also need to think about your process. Generally, there's two stages when you're doing your study selection. The first is your initial screening, and that's where you sort of ask the question, is it possibly relevant or not at all relevant? And so you exclude all of the, if you're looking at a review obviously within Cochrane in human studies, then you can you know, exclude the ones that are all done in animals, for example. And then you have that second stage of where you're looking in depth. In a lot of cases, you're pulling the full text if it's available. And so what's important to know is that you need 2 independent reviewers for the selection process to reduce your you know, selection bias, overcome human error. And you also need to have the process, so you know what kind of system, you agree on a system. Is it going to be yes, no, maybe? You should think about having an area for comments and notes when you're pulling together the study selection, and it's something that you could set up an Excel spreadsheet for example, or that kind of thing. And then you also need to think about your process for resolving disagreements. So are you going to come together and try to achieve consensus and then pull in a third-person arbitrator, for example? So it's not just what we're going to select, but also how we're going to do it. So both elements are important for this process. You need to keep in mind articles that are published in other languages, as we had already seen, that it is a separate step from collecting the data. So you're just figuring out whether something is, you know, whether it meets your inclusion, and you're not really looking at the data at that point. It's a separate step. Something to think about is pilot testing your eligibility criteria. So that's taking a few sample studies, and you and your independent assessor go through and, you know, are the eligibility criteria clear? What other decision rules do we need to have in place, etc., so that you could try to minimize the amount of disagreements that occur at the end of the stage. For the full text, that second step of screening, you also need to explicitly list any articles that you excluded and the reasons why, and that's a means of transparency for your readers, and all of that is included in the Cochrane review. So it's not just information about the included studies. You'd certainly list all of your excluded studies, you provide a citation, and your reason for excluding. Okay, are there any questions? We're at the end of the session. Okay, if not, what I thought I would do before we leave is I have a sample protocol that we can take a quick look at. So I'm just going to activate the application sharing. It should pop up in a minute. And again, for those of you who are on Windows platform, it should come up as a floating window, and then you can expand the width out a bit. Just allow me a moment. Seems to be having some difficulty with this. Okay, now it should work. Okay, so it should just be a minute, and everyone should see it. So you can just sort of send me a happy face through if you've got it on your end. Okay, and I'm going to just expand this out a little bit myself. And okay, great. Before I scroll through this, I just want to take, there are a couple questions that came through. One question is, how do you deal with studies in different languages? And what happens with the collaboration is, quite frequently I have messages that come through. We have listservs for staff internally. And people will ask, you know, I have this trial in a certain language. Do you have someone, is there anyone who could offer to translate it, or do you have people within your network who could translate it? So that's how the translation piece is done. And so that's an opportunity for people to be involved as a volunteer with Cochrane, is to offer to translate studies for other review groups. Next question is regarding the research questions. What kind of proportion are rejected and why? So why a question might not be taken on, was that the question? By a particular review group? I just sort of just wanting verification. That's okay. So I haven't been too involved in that process, so that's a good question. So what I suspect is if a review has already been addressed by another group in that area, would be a reason why a question would be rejected. If it maybe makes sense for it to be too broad or too narrow, is something that's just another possible item. Again, I haven't been involved in that process, so I don't have an example, a sort of a real sort of concrete example. And I don't know what proportion of research questions are rejected either, whether it's a high or a low or any of that kind of thing. So if you're curious, I can certainly ask for a little bit more feedback on that particular question and provide it to you in a way that's anonymous. It doesn't really, you know, provide any identifying information, certainly. Okay, so let's take a look at a protocol. So you should be able to see my my mouse move around. So this is the front page of a Cochrane review. Let me just scroll down. It has a table of contents. So in particular, I just wanted to bring you to, this indicates this top part that this is a protocol and that there's no abstract because it is a protocol, so it's a placeholder for the abstract. So with this one, they've spent a lot of time describing the condition, providing rationale, background information. They're describing the intervention here. Just to move back up, sorry, that was really quick, so I'll just allow a second. How the intervention might work. So that's sort of your rationale behind why you're looking at it. And then why it's important to do the review. So it really sets the stage. It's that justification for why undertaking the review is important. So this is your objective here. Then you start to get into your methods, and you can see on the right, this is where they outline their outcome measures, and that was the example I provided in the slides. You can see the types of studies, the types of participants. It's very clear. They outlined information about the interventions, where people would search. And then some of these items we'll take a look at next week. So the study selection we did today, but you know how they would extract and manage data, assessing risk of bias, so that's the critical appraisal piece. What they will use to measure treatment effects. Any other issues, so unit of analysis is something that some authors have to consider and determine how they're going to handle it. Missing data. heterogeneity, and that's just looking at variation, how you're going to handle that, reporting biases, synthesizing the information, again, other items like subgroup analysis, sensitivity analysis. So all this is outlined. Any acknowledgments that need to be made, any references. So I'll just scroll down, and then here's your search strategy. So yes, it's included in the protocol, explicitly outlined before it's actually run. Contributions of the authors and declarations of interest. So it's internal, external sources of support. Okay, so hopefully that gives you a sense of what a protocol looks like. And I'm just going to release that. So if there aren't any further questions, then I will end the session. Thank you very much for joining me today, and I will outline the remaining steps of that wheel next week for our final session. And after I stop the recording, I will send the slides through. Have a great day.